Go.
Okay, so today I'm going to talk about the care of older adults. I took a look at your syllabus like Dr. McCormick said, and you guys will be working on this week, so I felt like that would be a good time to get you guys ahead of things. So we'll talk about this now. So some objectives that I hope at the end of this, you'll be able to identify 3 normal and 3 abnormal age-related findings, which you guys just had geriatrics prior to me. Yeah, so this is perfect. Okay. You'll be able to differentiate cognitive changes in older adults by listing at least 2 characteristics of delirium versus dementia. We'll also be using 2 different tools. We'll be using the SPICES tool to assess it's a very short case scenario of an older adult. And then we'll think about nursing considerations with that. And then lastly, we'll go over and watch a short video on the 4 M's. And I think Kimmy actually might have talked about the 4 M's. I don't know if she talked about that with you guys. But that was a huge initiative that she started as the geriatric educator. When we have older adults, we ask them what matters. So we'll be taking a look at that as well. Okay, so perception of well-being defines quality of life. I really like this quote because our older adult population, they really consider their health based on what they can actually physically do. And that could be physical, emotional, or social functioning that they really equate to their quality of life. So for instance, you can have an older adult who has a cancer diagnosis and is going through chemo, but as long as she can go up the stairs and still cook her meal and do what she needs to do, she's going to consider herself probably healthy for the most part. But then on the other side, you can have someone who has a swollen knee, otherwise healthy, older adult, and because they can't maybe drive or maybe they can't do some functional abilities that they were able to do, they might consider themselves ill. So that's what that quote really means. So they really, if they can perform activities of daily living, they consider themselves healthy. So we have to consider that when we're taking care of this population. All right, so some aging processes and nursing considerations. I'm only going to touch on a couple of them because this is only about 15 to 20 minutes. You will probably go into depth and more into your readings, but I just wanted to start off with cardiovascular. And again, this is very individualized. This depends on how they live their life, their lifestyles, genetics, but this is a general sense of the aging process. So cardiovascular-wise, stiffening of blood vessels and higher systolic blood pressure. So as the nurse caring for the older adult, I may check their blood pressure a little more often, or I may think of, all right, are they able to tolerate certain exercises based on their blood pressure? What about respiratory, decreased cough reflex, and chest wall flexibility? What do you guys think? What would be a nursing consideration based on their aging process that these changes are happening? What would be things that you would think about?
Trouble swallowing?
Trouble swallowing. Airway, someone said airway?
Yeah.
Airway, what else? Anything else?
Pneumonia.
Pneumonia, right? Central spirometry, yeah, exactly. So I would start thinking about encouraging that deep breathing and central spirometry, monitoring for respiratory infections. I didn't write it here, but I definitely would think about pneumonia, their swallowing, and infections. All right, musculoskeletal-wise, decreased muscle mass and bone density. What would you think about here? Falls, right? Anything else?
Pathologic fractures.
Yeah. So for me, I would think assess that mobility status. A lot of what you guys said already: physical therapy consult, implementing falls precaution, and the weight bearing exercises with aging. All right, and then lastly, the immune system. They have a lowered core temperature elevation, so reduced fever response. What would you think about in this part?
Dehydration.
So you have a patient who's coming in, and maybe you're thinking they have an infection, but you're not seeing the temperature happen, right?
Lower ability to fight the infection?
Yeah, so you have to think of like those other signs, right? They're not going to give you those classic signs and symptoms that they're used to, right? So the first thing you might see is a acute change in their mental status, and we'll talk about that again shortly, because if you have a patient who's 30 years old and you get acute change in mental status, we all like run wild, right? We're like, all right, we need to call a rapid response. But when you have your 70-year-old or 80-year-old patient who has a mental status change, sometimes people say, oh, he's just old. But that should be a trigger for us, right, with that older adult population. So monitoring for those subtle signs, considering other indicators, confusion, fatigue, or other vital sign changes. Great job. Alright, so some normal versus abnormal findings of the older adult, and again, like I said, those things should be popping in your mind when you see acute changes and not just associating those to just aging. Cognitive changes, I'm sure you guys have heard this already with Kimmy, but delirium versus dementia. Again, that delirium is that sudden abrupt change. So your patient who you've been taking care of, if today they're more confused, that should be something that's on your radar. Dementia is a slower progression. Progression-wise, rapid, abrupt dementia, you're gonna have that slower decline over months. Alertness for this, delirium can fluctuate, but for dementia, it should generally be normal into the later stages. Orientation-wise, they're both often impaired, but with the dementia patients, and I just noticed this actually recently with one of my family friends, she's been diagnosed with dementia. When you are talking to them, you're not gonna notice at first when you're talking to them. When you ask them direct questions, it says that they'll start answering other questions but the question that you're asking them. So they tend to try to answer you, but you're not getting that answer that you actually asked. So that's what happens sometimes with dementia patients. Alright, so things to consider when you're doing your assessments. You wanna recognize these changes can affect their mental, their health, mood, and independence, and social engagement. You want to evaluate how these conditions affect their activities of daily living and their overall independence, because that really affects how they visualize if they're healthy or not. Tailoring the assessment to the older patient, so you want to use age-appropriate communication, consider sensory deficits, cognitive status. Sometimes you might have to pull in a family member or whoever they have on their chart, cultural background, and individual preferences. And we will utilize the worksheet that I gave in front of you in a second. So 2 assessment tools that are geared towards the older adult is the 4M's framework to guide the care of the older adult. And the second one is the SPICES tool, which I gave you. It's an acronym that has common syndromes of the elderly. So S, sleeping disorders, P, problems with eating or feeding, I, incontinence, C, confusion, and then E, evidence of falls, S, skin breakdown. So what matters, this is really just doing that patient-centered care, asking them what's important to them. So for instance, if you have a patient who comes in, you might give them a diagnosis and there may be choices of things that they can do, whether it's surgery or whether it's making them comfortable. But you really need to know what's important to them to really individualize that care. And we'll watch it. I'm gonna put on a video. I'm gonna do like the first few minutes of it because it is a little bit long. But you wanna know what really is important to them so you can tailor the care. Medication-wise, you're gonna hear this again in your lecture, but the age-appropriate medications, right? We don't wanna increase the chance that they're gonna become delirious. We don't wanna affect their mobility, their mentation. So prevent, identify, treat, and manage any dementia, depression, or delirium across the healthcare settings. And their mobility. We wanna keep them moving, keep them active as much as we can. So maintain that function. And those are things that really do matter to this population.
As to me, it's the love and the eye contact and the genuine perception.
I want them to know who I am, not what disease am I, or what age am I, or how tall am I.
It's important that I can stay with my mom.
What matters to you is about knowing our patients. You have to have that starting point in order to begin working as a team.
I think it establishes a relationship, and the relationship needs to be one of a partnership.
questions get asked in a number of different ways. I might ask, what makes a good day for you? Or what are you most proud of? Or what matters to you? What gives you hope? What gives you courage? And in those conversations then, what matters to them comes out over and over again.
I introduce myself, I go into the room and say, my name is Joe, I'll be your nurse for today.
You need to maintain your eye contact with a smile, come in gently into the conversation.
It helps when people are friendly.
Congratulations, it's exciting to hear that you're pregnant. Thank you. Now, when looking at your prenatal care, you have several options from an obstetrician, a family doctor, or a midwife. In order for you to make that decision about how you want your pregnancy managed, I need to know what matters most to you.
I think because this is my first baby, what matters most to me is happy.
For the sake of time, I'm gonna pause it there. I just wanted you to see a couple ways that you can use it. It's not really a script if you see that in the video. It's more of a conversation. So you can ask it, several different ways. One of the ways that Kimmy put it was for the nurses. There was like a little sticky note in the charts, and you ask them what matters. And you can ask them in several different ways. But for instance, like you can see that the previous nurse wrote that maybe they're excited about going home to their pet. So when they're in the bed, maybe they're saying today, like, oh, I don't want to do physical therapy, I'm too tired. Like you can bring that up and say, oh, I heard you're really excited to see your pet, your dog, whatever it may be, and talk to them about that. Make it personal, make them motivated, because it could be depressing for them to see that their decline is happening, that they're not able to function as they did before. So that is some way that you can make it more personal for them. All right, so this is where we can use our checklist that I gave you. Turn it over. The acronym is there, SPICES, and it says what each one represents. So S, and you could just put A, B, C, D, E, F where it matches in the acronym. So for instance, lives alone, uses a cane at home, where would that fit on that acronym? Yeah, go ahead and write it in there. Wherever you think it, I'll give you like a few seconds. It's pretty straightforward. If you have any questions, you can ask. I made it so one should fit in each slot, hopefully. You guys all good? Yeah. Okay, so I'll just bring it up on the next page. So, for S, the patient had some pain that interrupted his sleep. So these are things that we're thinking about in this older population. So common syndromes that happen. Nursing considerations, I wanna make sure I provide pain management. Adjust the sleep environment, consider sleep hygiene. And I'm doing this because I wanna prevent delirium in the hospital, right? I wanna make sure they get proper sleep hygiene. Eating, he's skipping meals, recent weight loss, right? This is concerning. You wanna assess the nutritional status. Sometimes you can consult nutrition to come see them, maybe get extra protein into their diet, encourage small frequent meals, and monitor their eyes and nose. Incontinence, occasional urinary leakage at night, implementing that toileting schedule, assessing the skin. Confusion, mild post-op confusion. So we wanna make sure that we reverse this. We don't wanna let it continue with this confusion. So we wanna orient our patient frequently, monitor for delirium, and ensure a safe environment. Cause that's increased risk for what with that delirium? Especially with everything else is going on. That evidence of falls, right? We wanna make sure he doesn't fall again. So we wanna do the falls precautions. When he's being discharged, I also wanna make sure, does he need a PT consult? Does he have the proper equipment? Maybe he needs a walker, a cane. Is he a safe discharge? Does he have that support at home? Does he need to go to rehab? right? These are things that I'm thinking when I'm taking care of this patient. Skin breakdown, repositioning, pressure relieving mattress, and monitoring that skin integrity. So this is just a good acronym to use when you're taking care of the older adult. Any questions so far on that? That's good. So aging is a normal physiological process, it's not a disease. We wanna make sure that we tailor our assessments to this population. Think about the medications that we're giving if they're on that list, that increases their risk for delirium, and so on and so forth on that. Safety considerations. Want to use tools. There are different tools out there for the older adult. These are just two that I brought to your attention, but we want to make sure that we're age sensitive and we're providing that holistic care for our patients. Has anyone ever taken care of an older adult, by the way?
Yes.
Yeah, okay. So you can see how this can come in handy with this. Okay. Alright, so the older adult population is projected to double by 2060. The number was pretty wild. So there is a demand for knowledgeable, skilled, and compassionate nurses. So hopefully, some of you may consider going to older adult. I know Kimmy loves it. She was here talking way past her time.
She had fun things. Like
She
had
has
fun,
like,
yeah.
she had like the fun things like you put the headphones on and yeah. So she's really passionate about that. And we're just hoping that, more nurses go into that field because sometimes it gets a bad rap, the older adult population for being a little bit more difficult. But I think that if we think about it in a different light and really just take into consideration like what they think is healthy, right? And you would wanna, as we're aging too, we wanna be the same way. And I think